Good day, everybody, and a warm welcome to everybody who's joining this webinar. My name is Sarah Hess, and I work for the World Health Organization in Geneva, Switzerland. This webinar is part of the sub-theme of the Prince Mahad Award Conference that is entitled Drawing Lessons from the National and International Preparedness and Response to the COVID-19 Pandemic. The specific title of this webinar is Communication During Health Crises, How to Translate the Science into Policy and How to Manage the Infodemic. I'd like to welcome you all here today. A few housekeeping rules before I hand over to the chair. We hope to have a time for questions and answers a little later in the session. So please, if you do have a question for one of the speakers, use the Q&A function of Zoom, type in your question, and if it is for a specific speaker, please indicate their name. And also, this session is being recorded, and so there will be reruns of the session available at the pmac2021.org website. So without further ado, I would like to hand over to Dr. Sylvie Briand, who is going to make some opening remarks.
Good morning, everyone, and thanks a lot, Sarah, for your kind words of introduction, and welcome all participants to this webinar. This webinar, as Sarah said, is about communication during crisis, translating science into policy, and managing the infodemic. Let me just set up the scene and first explain why we propose this topic to the PMAC Secretariat. It's a part of a series on which we hope to learn a lot from this current crisis, and this is why we thought that this subject was so important, because you have seen since the beginning of this pandemic that there have been a lot of information, a lot of media articles, a lot of scientific articles. So information is something we don't lack currently. But how can we manage this information? At WHO, we talk about infodemic. An infodemic is a tsunami of information, some accurate, some not, that spreads alongside a disease outbreak. Infodemic is not a new phenomenon. We have infodemic during every outbreak we see, for Ebola, for yellow fever, for cholera, for meningitis, for plague, for any kind of outbreak. But the infodemic of COVID-19 is very special. Why? Because in the digital age, the broad access to social media, infodemic management is even more challenging. Rumors, fake news are spreading further and faster than ever. And we know that you cannot eliminate the infodemic. You can just manage it and make sure that everyone can get the right information at the right time, in the right format, so that they can make informed decisions to change behavior and protect their health and the health of their beloved ones. For us, what is really important during this webinar is that we have tried to understand better infodemic management during this crisis by inviting 4 different speakers, because we wanted to look at this issue from different angles, different perspectives, so that we can learn even more from this phenomenon and how to manage infodemic better. So that's why we invited an international public health practitioner, someone from national public health authorities, a scientist, and a journalist. And each of them will talk about their experience, what they have learned personally from this crisis, and this will help us to draw lessons from this. And we count a lot from your input as participants, your question, so that we can even get further in this learning exercise and this collective accumulation of knowledge that will help us to be better prepared for the next period of this pandemic, but also probably next pandemics that may come in the future as well. So I hand over back to Sarah to moderate this session, and I'm very happy to be here. Thanks again to the PMAC Secretariat for organizing this webinar and supporting us in this discussion. Over to you, Sarah.
Thank you very much, Sylvie. And the first speaker that we have with us today is Dr. Michael Ryan, who is the Executive Director of the WHO Health Emergencies Programme. Dr. Ryan, we're delighted to have you with us here today to present the global public health perspective on communication and managing the infodemic. We do have a number of questions that we've prepared for you, and so we would welcome your input and your feedback on these questions. You do have extensive experience in responding to outbreaks around the world. However, this pandemic is very different. It impacts the world globally, and it gives a very different role to WHO. I wonder if you could speak a little bit about the specificity of this pandemic in terms of communication, and what are the challenges at different stages of the pandemic that you have seen. Over to you, Dr. Ryan.
Thanks, Sarah, and for all you and the team do to highlight and advance our knowledge in this area. And good morning, Jason and Uge and Viraj. I'm really looking forward to hearing your insights and also having a good Q&A at the end. I think, as Sylvie said, communication, knowledge, behavior are an exceptionally important part of all epidemics, and my experience has always been that no matter what, the micro or the macro level, in not linked to the scale or scope of the epidemic, communities are ultimately the secret weapon in fighting epidemics. Communities stop epidemics. Scientists don't stop epidemics. Communities stop epidemics, and it's usually through their knowledge, their behavior, their solidarity, their care for others in their community, and their ability to apply knowledge to their risk or the risk of others around them. And that's why it's so important. It's not just about getting information to people so they know. It's about getting information to people so they act. And there's a big gap between information and knowledge and action, and that appropriate action. And in this pandemic, sustaining that action. I think we as human beings we have an innate fear and I think a rational fear of contagion. It is imbued and informed our culture, our behavior, our religions, our civilization for millennia. Ever since we settled down into closed communities, epidemics have ravaged our communities over time. They've shaped civilizations, they've brought down governments, they've brought down monarchies, they've won and lost wars. They're an integral part of our civilization, but they do strike that fear. No one, myself included, we are all fearful of that organism. I've spent many a day on an Ebola ward, and others sitting here with me, Nikki and others, have had that same fear as a health worker. No amount of knowledge gets rid of that fear and that sense of trepidation. But what fear can do is paralyze. What fear can do is misguide. What fear can do is generate reactions that are neither good for the person nor the community. And in that sense, it's not about getting rid of fear. It's not about that. Fear is a good instinct. Fear protects us. Fear, in a sense, that sense of being aware of the risk rather than fear. And turning awareness of risk into effective action is really the trick of communications. And one of the objectives of infodemic management is to get the right information to people at the right time and ensure that they're empowered to make good decisions. So in that sense, this pandemic has taken all of those issues and amplified them. The sheer scope, the sheer scale, the duration of this pandemic. The fact that the pandemic has been very differential in the populations it affects, the older and vulnerable versus the young. It's created all kinds of tensions and tidal forces in society. It's also information, and the pandemic itself has been subject to political interference, and I would suggest political weaponization, which has further confused and made more fear where it does not need to be. So in that sense, it's a perfect storm, but it's also a huge opportunity and a responsibility more than an opportunity for us in the scientific and the communication and the journalism community to see what this means for the future. Learning how to cope with this and preparing for the next pandemic or the next Ebola or whatever it is, we're learning. And we have a duty to learn because people are suffering. And if there's any, we want to end this pandemic, but we also want to learn for the next one. So we have a duty to learn that. So from that point of view, it's very tough. The other thing, and I'll finish after this, is sometimes, and I think this is an expectation of science and medicine, populations are confused when we give them solutions. They say, well, surely there's a vaccine, surely there's a therapy for this. And when the intervention is actually about behavior, they don't quite get it. Seriously, this is going to work, and there's a disbelief sometimes in communities that these are the measures. And there's a criticism of the scientific community. Is that all you can come up with? You know, is that it? And that's certainly the case when you don't have the knowledge, and we're saying constantly we don't know everything, little is known, we have more to learn, and the community are hearing that, and on the other side, they're fearing that everyone's going to die. And that gap in scientific knowledge and solutions can either be used to drive solidarity to work to gain those solutions, or it can be a wedge that's driven between science and the public, or science and governance. And unfortunately, I think it's been a wedge this time round, and there's been a huge polarization and a loss of trust. And that's not just between science and the public, it's science, governance, and the public. And I think that is, for me, a really important triangle. It's not just about communicating to the public. In between that, there is government, and in some circumstances, governments have really worked hard to be accountable. And I would like, given that this conference would have been in Thailand, to commend the communities in Thailand, the scientists, the frontline workers, and the government for really showing the world that an integrated, caring, community-focused, community-centered response is possible, and that controlling this virus so as to reduce its impact is possible. And I think Thailand is a living, walking example of that. And I hope as we get to the end of this conference, we'll have some lessons around where we need to go next. Back to you, Sarah.
Thank you very much, Mike, for sharing your insights with us, particularly highlighting the importance of translating knowledge to action and empowering communities to take action. You also spoke about the hugely complex nature of this pandemic. And I think you have obviously witnessed that firsthand. You've become a very familiar outward-facing presence during the pandemic through the regular press briefings, trying to navigate that complexity through regular communication. And I wonder if you could share a little bit with us about what you learned from these press briefings, this experience. And do you think this will be a new way of communicating for WHO in the future? Over.
Thanks, Sarah. Yeah, they're quite interesting events. I think, first of all, it's really important that those of us that have influence on policy remain open, accountable, and listening. And I think our primary engagement at the press conferences through the media and through journalists. And journalists have a very important job to do as well, to be able to communicate to the public and hold us accountable, ask the hard questions. And particularly as scientific journalists in a situation where we have an emerging disease, and many of the concepts are very complicated, knowledge is not perfect. And sometimes we make a mistake in trying to simplify information for people. I think people are very intelligent. I've seen that in the rainforests of Central Africa. People are inherently smart. They're survivors. We as a species have evolved to be really good risk managers. That is the hunter-gatherer way. We've learned how to manage risk every single day of our lives. And I think we're inherently good at that. We can process information really quickly and we can take action. We need to have the information and be empowered, as you said, Sarah, to take that action. Science journalism is extremely important because instead of simplifying, it can distill. And distillation is the process of making a more concentrated and better product rather than simplifying, dumbing down. And I think sometimes things get dumbed down and they get unfortunately translated, and I've seen this more and more in this pandemic than ever before, into binary concepts. It's this or it's that. It's airborne, it's not. Wear masks, don't wear masks. Trade-offs between the economy and the outbreak. And people, it becomes a competition of opposites. And unfortunately, biology is not like that. Biology is messy. and civilization is messy, and politics is messy, and society is messy, and things aren't as clear or as obvious. And I think we've all erred in trying to be right or trying to be wrong, or demonstrating how right we are or how wrong you are. And I don't think that's helped our communities in that that polarization and creating binary arguments all the time. And I think that's fed into a way in which politics has been able to utilize science in a way that's not been necessarily helpful at times. And I do think it's important that we can explain complexity. It's not about getting rid of complexity. Complexity exists. Complexity is real. The skill in explaining that complexity and distilling that into actions that people can take in a credible way, to me, is key. And the press conferences are an opportunity for us to do that. But that's not the only thing. I mean, if you think about the number of EpiWin webinars, then we have weekly global meetings with all our member states, our executive board. We have one-on-ones, bilaterals. Our regional directors and regional teams are constantly convening meetings at regional level. There's a constant process of engagement at all levels of society. But uniquely this time around, I think WHO and yourself, Sarah, Sylvie, Tim and others, and Mindy and others here who've worked on that with other partners, I think that's been one of the great innovations in this response, is that WHO has really engaged on how to use information in a hugely positive way, deal with disinformation and misinformation, amplify positive and correct information. And everybody is doing that better now than we've done in the past, and we need to. It's a critically important part of the response. So I wouldn't say that the press conferences are the most important thing for WHO. I think they are a way of us communicating, but there are so many other channels now. I actually find I do Facebook Lives once every 2 weeks, and I actually find them much more enjoyable, much more insightful for me. The questions are coming from the public, and they're actually, to be quite frank, sometimes much more penetrating and much more demanding on me than some of the pat journalistic questions that are much more predictable. And I find the questions coming from the public make me think more. And actually the questions become information for me, because the questions that are asked reflect sentiment, feeling. And I think measuring sentiment and feeling is really important in this. And again, I'm a recent convert, and not recent in the sense to that, but I see the way sentiment monitoring here has been really helpful for us to understand how people are thinking, because that allows us to communicate ahead of time in a much more important way, because sentiment turns into behavior. You feel something before you do it. And if we understand better how people are feeling in terms of how much they believe, how much they trust, which specific issues are of concern to them, then that allows us, I think, to shape our communications and to shape our messaging in a way that the customer, the client, the population are getting a better product from us. Back to you.
Thank you so much, Mike. It really is about that two-way dialogue. We'd like to just take 1 or 2 more minutes of your time. With all your experience in communicating during the pandemic, if you had to summarize in 1 or 2 sentences or describe what communication should look like in a crisis such as this, how would you describe it?
I was always taught, my grandfather was one of the first policemen in the newly independent state of Ireland, and he was an old-style policeman, and he always taught me to answer the question you're asked. Don't dissemble. Don't run away from the question, because the question is important because it says something. And even if that question is uncomfortable, even if that question is not the one you wanted, it's the one that needs to be answered. And I think in this, we need to be much more willing to admit uncertainty, not to peddle uncertainties and absolutes. That's not the way our society works. I think we need to be, what would you say, authentic is the word. Just people need to see you as a real person. We are here in WHO. I mean, many of us haven't seen our kids. I've seen my kids once since Christmas. Many of our staff here are international staff, and their families are in other countries. We're all stressed. We're concerned. We're worried. We're concerned for the future. We're worried about our parents. We have exactly the same issues, and we have to manage that. And I think we need to dig into that, and we need to reflect that more in an honest way, but not in a way that paralyzes us, but in a way that empowers us. We are just as much members of our community here in WHO, our community in Geneva, our extended global tribe in the UN system, and I don't think that shows weakness. I think that shows strength. That when you're not telling people you know everything, and you're willing to be open and honest about your uncertainties, I think that resonates better with people. So I suppose that's the only, beyond all of the techniques we all are taught and learn, I think from a spiritual perspective, and I think you said the word dialogue, persuasion is what we need to do. If you think about your own life and moments in your own life when you changed course, very often there was another human being involved in that. Someone who gave you the information, persuaded you, allowed you to ask questions, could have been a teacher, could have been a mentor, could have been a partner, whatever it is, right? And think about how we have our own selves changed our behaviors or engaged in taking a different path. And very often it is another human being that has helped us on that journey. Now, we all need to become that human being for other people and for ourselves. And, in that sense, everybody is a pandemic fighter. Everyone is part of this response. And we say it, and I know it can sound cheesy at times, but we're all in this together in a sense that we all have a part of the answer within our own behavior, within how we influence and persuade others. Our job is to amplify that empowerment, that people feel that they have some control over their destiny, over the safety of their family, over the safety of their communities. And if people feel that sense of responsibility, and if they have the information and knowledge to make good decisions and to act, then we'll have much more impact on this epidemic. So this isn't just about smoking the bees and keeping the population happy while we control the disease. And that's sometimes how people have seen communications in the past. It's about keeping everyone calm while we get on with the really important job of stopping the epidemic. That's not how it works. I think the population need to be empowered to get on and stop the epidemic just as much as we do. And I think if we see our communities as partners, as fellow travelers on the same journey, then we have more respect for them, and I believe they will have more respect for us. Back to you, Sarah.
Thank you very much, Dr. Ryan, for your precious time, but most importantly for sharing with us your wisdom and insight that has so much empathy and humility in it. And it was really a pleasure to listen to your answers. I'd like to now introduce our next speaker. This is Dr. Viraj Tangcharoen Satyan. Dr. Viraj is a senior advisor on international health policy in the International Health Policy Program in the Ministry of Health, Thailand. Dr. Viraj, welcome to the webinar. I believe you have a presentation, so there will be some slides shared on the screen now. Over to you, Dr. Viraj.
Thank you, Sarah. Thank you for the opportunities for this webinar. My topic will cover two areas. One is risk communication, how Thailand has been implementing to respond to COVID. And the second part is on how we manage infodemic in response to misinformation, disinformation. And this is a joint work by Orana, my colleague, and the team. I'm just a speaker on their behalf. On epidemic curve, quite a good number of countries manage their epidemic well, including Thailand. We don't have local transmission since 25th of May. All the subsequent after 25th May is international traveler, either Thai or non-Thai, in state quarantine. So we enforce mandatory 14-day state quarantine, and we test them on day 7 and day 12, and we all can pick up them. So the effective implementation by rapid response team, surveillance team, we have over 1,000 teams throughout the country We have invested in FETPs 40 years ago. We train full-blown, good, qualified epidemiologists and team up. We so far as of today, we have 3,700 cases and 59 deaths and no local transmission since 25th of May. This slide gives you a flavor that there's a synchronized between the peak of COVID epidemic as well as the number of misinformation. The spike of case report in March, the whole month we have 2,123 cases and we have detect 151 misinformation circulate mostly in social media. And social media penetration is very high as an upper middle income country when mobile phone, Facebook, Instagram are widely used by the population and go down when the peak has been gone. What did we do on risk communication? I would like to say that it is based on scientific evidence, truth, transparency, and whole of government approach. Whole of government approach was led by CCSA, which is COVID-19 Situation Administration, led by the Prime Minister immediately, very early at the epidemic since 12 March here. We use one voice to prevent miscommunication, distortion of message. Use live TV daily at 11 hours in the morning. It takes 1.5 hours televised throughout the country and was debriefed by an official source of information delivered by the speaker. You see Dr. Tawisin become an icon of daily situation update televised in all media channel and further propagated by many other channels. I will talk later in the next slides. Science-based. I would reiterate the importance of transparency, evidence-based. We do not hide any case and report every case and how we manage, how the government manage. For example, we have cluster of super spreader from boxing stadium as well as pub and bar in Thonglo, Soi Thonglo. That we government immediately contact tracing, test, and quarantine. Science-based, I would like to highlight the importance of science-based. In terms of risk communication, IHVP and partners, multi-sectoral partner conduct an online weekly survey since April 2020 until July. So weekly, since April, May, June, and July, 4 months weekly monitoring of people adherent of to face mask, second, hand washing, third, physical distancing, fourth, refrain from touching eye, mouth, and nose, and fifth, um, uh, food hygiene. And from these 5 sub-indicators, we produce a geometric mean of COVID prevention indicators and report this indicator on weekly basis through the speaker of CCSA. And this scientific evidence on people adherence to intervention, social intervention and public health intervention is so powerful to raise awareness and further inform how the citizen can prevent them. At the high level, up to 95% of face mask coverage in April is a strong message to foster that after that, if when we sustain very strong high level of indicator, personal prevention behavior, the case has gone down, gone down and gone down. So that reiterate the importance of public health intervention and gain trust by the citizen. Finally, is on multi-sectoral collaboration. We work with many actors, government, non-government, and amplify the message to reach the target population through this governance mechanism. Dr. Ryan, this is so critical information for we learn and draw a lesson from the past 6-7 months that on the left circle is health constituency on the green bubbles. Health including many MOH and non-MOH partners. We have 3 meetings per week by the EOC, the Emergency Operating Center in the MOH. And MOH is part of the CCSA constituency led by the Prime Minister. And you see the national spokesperson by the blue dot line. They send official information delivered by the national spokesperson on daily basis, and it reached the health workers throughout the country what intervention should be fostered. And health volunteer, we have 1 million health volunteer who support the local quarantine. The national spokesperson also sent a strong, clear message to the governor and the community leaders. The third channel is the media and news agency. Most importantly, we have anti-fake news center led by the Ministry of Digital Economy, MODE. So the red arrow, send a clear, amplify, verify information for further dissemination to the public by these 4 main channels. So this come from a grounded theory what we have implement and summarize the governance mechanism. We do not design this governance since the beginning of the function, but gradually it mold and gradually evolve along this line. On fact check, we have both national and international partners. In the month of April, May, there's about 1 million media message per month floating around in all the social media. In Thailand, during March, the whole month of March when the epidemic is peak, the Anti-Fake News Center can verify 184 both true and false statement. The core fact is private and civil society organization is a network of like my colleague, including media agency. They have verified 84 verification. And Sure Before Share is a media agency by a TV channel. They also verify 46 message. Of course, we have AFP, we have Mythbuster, we have Zero, the virtual fact and fiction, the virtual headquarter Mythbuster. We have correct all this, both true and false statement into our 10 weekly online survey between May to July. With two goals. One is to monitor citizen behavior and attitude on infodemic. And second, last 2 weekly survey, we assess the risk communication system from the perspective of the citizen. On media literacy, we produce a media literacy index, which is a geometric mean of capacity to differentiate misinformation and not to propagate. And total sample, we have 52,000 in the 8 weekly survey, online survey. On assessment, we have 15,000 samples. And these are the findings. We found that 82% of the 52,000 respondents have seen misinformation and disinformation in social media during the last month. And the media literacy index was 69%. The 69% is a geometric mean of 54% of capacity to differentiate false and misleading information related to COVID. So we pick up the verified message, both true and false, and ask the citizen whether they say this is true, this is false. And 87% did not share the false and misleading information. And we have also found that higher education, female and older person have higher media literacy index. On effective infodemic management, we have 6 attributes. First is the sustained national fact-check capacities. We felt that we have more or less self-sustained national fact-check capacity. Also, we rely on international fact-check, in particular Mythbuster and WHO sources. We need to ensure reliable government source for verification, because some are very much, as Lion has said, very much scientific, and some tweak and mislead information is so difficult to differentiate. This is true or this is false. We need to raise public awareness on the misinformation, and we need to disseminate scientific evidence from authentic sources, for example, from the WHO in local language, to form a positive behavior, as Ryan has said. There's some gap of effective and timely legal sanction on individuals who produce misinformation. So far, we haven't seen too many legal sanctions on that, despite the fact that under the state of emergency, the government has the full authority to do so. And we need to advocate public not to propagate or disseminate further the misinformation through social media. I'd like to conclude with this slide on effective risk communication in the first and second bullet, and how the infodemic management should look like. We felt that effective governance and the function of CCSA through transparent evidence base will gain citizen trust and adherence. So far, with multiple interventions, we can contain the epidemic quite well. We need to send a multilingual message, because we have 4-5 million non-Thai who are migrant workers in Thailand whom we produce Myanmar language, we produce Cambodian language, we produce Lao language, and both print material and social media as well. And the migrant health volunteer play also significant role in outreach the pocket of vulnerable population, to inform them how they respond. On infodemic management, the legal framework, the fact check, and the law enforcement is so critical. The major pain point is the inadequate and untimely legal sanction, especially the cross-border misinformation. We cannot do false statement from outside the country. I thank you very much, Sarah Hess.
Thank you very much, Dr. Viraj. I believe that Dr. Ryan already commended you and the government on Thailand on the effective communication, and thank you for highlighting that, the importance of a science-based whole of government approach with regular, transparent communication to build trust, and thank you for sharing with us today. I'd like to now introduce our next speaker, Mr. Jason Gale, who is a senior editor at Bloomberg News. Jason, it's very great to have you here with us today to give a journalist perspective. Mike already mentioned in one of his comments with regards to the press briefings that journalists have a very particular role to play in communication. And I wonder, during COVID and in this new environment, has the role of the journalist in communication and during a pandemic response changed? And if so, could you speak a little bit to that?
Hi, Sarah. Thank you so much for the invitation to participate in this webinar. I'm looking forward to learning a lot. I'm no scholar in media studies. I can only comment on what I've observed. And I think in general terms, the role of journalists has remained largely the same. We're still conduits for news. and that's not changed. However, I do think that the platforms that we use and how we operate has changed over time, and that change was occurring before the pandemic. To give you an example, when I joined Bloomberg as a reporter more than 20 years ago, I wrote exclusively for our wire service for print. Now I work across print, the web, radio, TV, and I do podcasts and help produce content, video content for Twitter and Facebook and YouTube. And that really reflects the various ways in which people are consuming their news. Because there are now so many competing sources of news, I think there's a need for information that explains the news, that distills, complex information and puts it into a way that is, palatable, if you like, is more easily understood. So I think that demand for clarity during the pandemic has really underscored the importance of analysis in news.
Thank you very much. Indeed, the diversity of sources of news has really exploded over the last couple of years. Did I cut you off? Were you continuing? No. Okay, good. Thank you. So I wonder if you could share with us a little bit of your personal experience as a journalist during this pandemic.
Yeah, so, it's been a real roller coaster, and I think we'll all have, war stories to tell about our experience during the pandemic. I thought my situation and not seeing my kids for several months was bad, and then I just heard Mike Ryan, and now I feel that he's had it even worse. But just to give you a bit of a hint, I think at the start there was a lot of confusion and excitement about what was happening, lots of adrenaline, then fatigue and low energy sort of crept in as we were sort of drained. I started reporting on this mysterious pneumonia outbreak on January 3. In that first week, there were, I guess, some mixed messages. We were told there was, for example, no human-to-human transmission going on. There was no nosocomial infections. And at the same time, we saw that the number of reported cases was increasing, and that WHO had activated its incident management system at the country, regional, and global level. And so I struggled with trying to reconcile, what those different things, and there wasn't a lot of clarity around just getting a more of a nuanced understanding of what was kind of going on, but at least behind the scenes. And then once we saw that there was human-to-human transmission going on for some time in Wuhan, and that a novel coronavirus had been sequenced as early as Christmas, Boxing Day, I think some mistrust, or at least my trust of the information that was being released was kind of eroded. From a work point of view, I wrote or edited an average of 6 stories and updates a day on the outbreak from mid-January until mid-February. And that's about 6 months of work in about 4 weeks. So I think journalists all around the world were doing pretty much the same. We felt we had to work harder and harder to keep up with the news. And then eventually, I think we realized that we couldn't keep on top of the news. The news flow was just too great. It was like watching fireworks explode. There was just so much to take in. And it was, to be honest, it was overwhelming and mesmerizing and a bit paralyzing. Then I think I personally defaulted to writing stories based on published studies and research that was released on preprint servers. But even that was a source of frustration because of the sheer volume that was coming out. And many of the papers provided only a fairly narrow understanding of the SARS-CoV-2 virus or COVID. And the challenge was to weigh up all this information and to piece it together and to see a sort of a bigger picture. At the same time, there was, at Bloomberg at least, an institutional demand for information. Bloomberg has thousands of reporters and editors around the world, but most of them are focused on aspects of the economy and business, and there wasn't much level of understanding about medical science or public health. So I needed to support colleagues who were all suddenly covering COVID in some way. And that was, I guess, the first few months. And by July, going back to the low point, I think I, was just worn down by the sheer volume of work, like I'm sure many people were. And then Melbourne went back into lockdown. State borders have been closed, and yeah, it was a pretty difficult time.
Thank you, Jason. I think you highlight really well that authentic lived experience of being overwhelmed by the sheer magnitude of information and news out there, and it's something I think that we've all felt at a global level. As my last question for you, I wondered whether you had any recommendations for the world of journalists and the media in terms of communication during infodemics. Over to you.
Yeah, thanks. Look, I think we could do with more help in evaluating the evidence. I think the question of information, whether it's true or false, a lot of it is pretty gray, and it depends on the context. And I think that, and also that the evidence is evolving, constantly. And what was true back in March isn't necessarily true today. For example, I published a story today about face masks, and people were saying, well, if we had this information in March, it would have been kind of different. And the fact is, the evidence from face masks has evolved. And so the information we had back in March might be seen differently today, but it was the truth at the time, based on what we knew. So I think journalists need to be helped along this path of discovery of what is the evidence, and I think the quality of the evidence, knowing that there is a lot of certainty about some evidence, not much certainty about other evidence, and to kind of help evaluate and assess information would be really helpful. Just one other final thing that I wanted to mention, and it's sort of my hobby horse. I think if you are, for example, an international body with members across the planet, and wanting to sort of communicate, I think it would, to the media in various places, I think it would be really helpful to vary the start time of press conferences so that people from all around the world get a chance to listen during their awake hours.
Thank you, Jason. Really practical advice that I'm sure we can attempt to take on board. And thank you for sharing with us your experience and for the incredibly important work that you do and continue to do. I'd now like to welcome our next speaker, Dr. Müge Şevik. Dr. Müge is an infectious diseases researcher and science community at the University of St. Andrews. And Dr. Müge is going to give us the science perspective to this topic and theme. I believe you have some slides, so those will be shared on the screen. Over to you now. Müge, you're still on mute. Are you able to share your slides?
Hello. Thank you so much for the introduction, Sarah, and thanks for the invite. So I'll be sharing my slides. So I'll be giving an overview from scientists' perspective. I'm a clinician and scientist, and I have quite a lot of interest in science communication even before COVID-19. But with the interest in science around January and also confusion and fear that we've been discussing about, I started to basically critically praise the published evidence and share it on social media, which highly attracted a lot of public interest. And so I'll be sharing my experience and also insights from this experience over the last 9 months. I mean, I guess as Sylvie suggested, you know, this shift away from traditional media now offers new channels for public health agencies, but also for scientists. But also it creates challenges as self-appointed experts without credible authority have an immediate platform to disseminate rumors and conspiracies. This has been one of the challenges for the scientific community. And when we look at the overwhelming, you know, misinformation and also sharing a lot of information on social media, this kind of makes this COVID-19 pandemic one of the biggest public health challenges and also probably the biggest communication challenge of our time. And when we look at the publications published since January, now up to last week, there were 80,000 publications. So from scientists' perspective, this is unprecedented and also quite quite difficult for us to follow all the evidence coming out as well. So from a scientist's perspective, the struggle mainly is you know, personal, because the struggle with misinformation comes from our patients, family and friends. And how do we talk to them, especially who turned skeptical about the spread? And also, like, you know, responding to all these fake news becomes quite exhausting and never ending. And also recently, I guess, academic debate has become quite, you know, rough and tumble. Probably many don't really know, but academic debate is rarely probably courteous affair that people outside of academia may not know. But since the pandemic started, it has become quite difficult. So I'll be going in detail about this a little bit later. And for many scientists and physicians, I think science communication is time consuming. It's an extra work which is not acknowledged in terms of academic work or also scientific work. And most people doing science communication is doing as like an additional work on the top of their routine full-time scientific or, you know, clinical work. And there's also what I've been experiencing and many people suggest is, you know, there's difficulty in explaining this complex concepts to a lay audience. And I think this is mainly to do with the lack of training, because it's not mandatory for any scientist or physician to have a science degree or even any training about how to communicate. And I think it's been quite stressful for many of my colleagues, scientists and physicians, because many have been receiving threats and attacks on social media, receiving calls and messages. And this is because they've been trying to communicate the information. So I guess, like, when I asked my colleagues I was going to give this presentation, they basically said, is it our duty to fight for science, or is this futile? I guess the reality is the public overwhelmingly desires for scientists to engage in dialogue. This is a poll from the UK, and majority of the public agree that it's important to know about science. And when we look at how they feel about the information sphere, many overwhelmed with conflicting information. So 7 in 10 agree that media sensationalizes science, and there's so much conflicting information, and it's very difficult to what to believe. And there are also negative assumptions about science reporting. You know, people tend to make negative assumptions about when it comes from from journalists. It's not mainly about science journalists, but generally half think that journalists writing science stories only occasionally hold relevant qualification, And generally people find it quite, negative, or, not complete stories, quite overwhelmingly negative. And there's a high desire for scientists to talk more to the public. So half of the public think scientists should be rewarded for communicating their work. 7 in 10 want scientists to talk more about the social ethical implications of their work. And when we look what generally public thinks, they basically feel that scientists should be engaged in dialogue much early on, not after the information is out there, but before or at the time the scientific process or clinical trials are ongoing. It's quite interesting because they suggest that we should be able to slow things down, so there's thinking time public should be taken seriously. So this takes me to the importance. This takes me to the importance of science communication. So on one hand, there's a need to promote science to general public in order to inform, educate, and inspire next generation of scientists. On the other hand, there's also need to engage effectively in public dialogue, as public opinion also, on scientific issues can have significant effect on policy at government level. So I guess generally I feel that enthusiastic and dedicated experts in science communication is vital. There's evidence that scientists can stop the spread of false information by explaining the techniques of science denial or misinformation. And especially doctors are well positioned to deliver the truth because the credibility of the profession. For example, in 2019, Gallup poll ranked nurses and doctors first and third for perceived honesty. But one thing that I've learned over the last 9 months, culture is in communication, not just the content. So we know that infodemics are not new. Despite the efforts of Copernicus, some are still unconvinced that Earth orbits the sun. The world is hurtling towards rapid and irreversible climate change. Scientists seem pretty sure humans are the problem, yet it turns out people aren't aware of that consensus. So similarly, we have problem with vaccine hesitancy. And this pandemic, with its myriad uncertainties, which has been discussed already, and well-publicized retractions, shifting recommendations, also probably exacerbated this uncertainty and also distrust in science. So I guess scientists, as scientists and the community of scientists, we need to understand that people whose objections to COVID are based on something more fundamental than facts. It's their values and worldviews. People take a position not because of they don't agree with the fact, but it's based on their feelings, especially their feelings about what they fear, as it's already been mentioned. And I think there's also general distrust in science in today's world. And once beliefs become fused to sense of personal identity, they become difficult to shake. So I think we need a two-way dialogue. Facts are not sufficient by themselves to overcome skepticism. And we need to understand why somebody may have a belief or a different understanding, what's their view. So I think we need to acknowledge more where their information is coming from, what's their views, and acknowledge the information sphere is difficult, and you can understand why somebody would be confused. And we need to use facts as the foundation for a strategic conversation, not just the sole information. And probably one thing that I've learned is shaming people is often counterproductive when the aim is to foster trust and behavioral change. So yeah, understanding the public and their perspective is key. So I'll move on a little bit. And the other thing is the understanding the science communication and professionalism, and acknowledgement of when scientists are stray from their area of expertise, and also like showing kindness, listening carefully, even on social media is possible, and showing disagreement respectfully, valuing different perspectives. And I guess like scientists and physicians, we could be role models on social media, showing all these important traits, because people consider honesty, ethics, open-mindedness, being a good communicator as the best traits people consider most important for scientists. So what I could say is that the privilege of engagement comes with responsibility. So as scientific community, we need to establish trust, respect others, maintain professionalism, recognize our social responsibility, and engage in conversation rather than just sticking in one-way dialogue. And I think many things could be said here, but the negative aspects, and those should be avoided, would be mixing personal and professional, especially on social media, reactivity, and forgetting that public is listening, and sensationalized reporting, even for scientists, is happening, and this should be avoided. And what we need going forward, so we're going to be stronger with more physicians and scientists that are amplifying positive messages. But scientists must explicitly recognize their social and ethical responsibilities. And this involves scientists acknowledging their limits, the limits of their knowledge, and avoiding commentary beyond their means of expertise. And I guess while scientists and clinicians are vital players, we need to acknowledge that we are not often formally trained on effective, responsible, and professional use of social media. So with such channels increasing importance, I think social media communication and professional ethics should be incorporated as a core competency of public health specialty. And the other aspect we need to do going forward is increasing collaboration between health scientists, social scientists, and communication specialists and journalists, because I guess there's a need for, to provide clear messages which will be well received and interpreted correctly by the target audience. So this is the summary. Scientists have a duty to engage in meaningful dialogue. Privilege of engagement comes with responsibility, and social media communication, professional ethics needs to be incorporated as a core competency, and hopefully we'll see more collaboration between scientists and journalists. Thank you. Back to you, Sarah.
Thank you so much, Dr. Cevic, for a very rich presentation, speaking so clearly about the role of scientists as communicators. I wanted to just invite participants to submit their questions into the Q&A. We should have about 10 to 15 minutes of question and answer time. So if you do have a question, please do submit it. In the meantime, I think I'd like to just pick up on one of the points Dr. Cevic just said about two-way dialogue, and ask you perhaps the first question, which would be, what do you think could facilitate the engagement or the involvement of scientists in this two-way dialogue? I wonder if, I don't want to put you on the spot, but I wonder if you've thought about that or have any comments on that.
So, I mean, I guess many scientists don't necessarily understand the importance of this two-way dialogue, because I guess we've been limiting ourselves to publishing activities, and many feel that, publishing is the end product of our work. But I think it's getting much more critical that we engage with public and communicate those results to the public. So I guess maybe over the next couple of years, it will become part of academic practice. I'm hopeful of that, and I'm trying to emphasize the importance of that. And over the last 4 years, I've been, about 5 years ago, there was no mention of science communication. And now we're hearing more about that in scientific conferences even. So I'm hoping that it will, there are several scientists who are quite interested and enthusiastic about this. And that's how we could encourage more scientists to be involved. This is my opinion.
Thanks very much for your response. There have been 2 questions in the Q&A. One is for you, Dr. Viraj. The question comes from Bin Gao, and it says, do you measure the effect of each link in the network of Thailand COVID-19 administration? So I presume this is talking about your whole of government approach. Do you have any comments to that question, Dr. Viraj?
Thank you for the question. We haven't have a comprehensive assessment on the effectiveness of each network, but we felt from the naked eye that response and the community response to a daily SITREP, I would say, situation report on the epidemic, the source of information, the site of information. We of course do not name, but we said this is the site, and this is very effective to take to increase awareness and start the process of test, trace, and quarantine. So effectiveness in terms of disease control, I would say it's very strong. But we haven't have a full-blown assessment on the effectiveness of the CCSA. But the outcome is quite well. It's not only risk communication, as I said, the SRRT capacity to test, to trace, and quarantine, the scaling up of face mask production and distribution, and the scale up of lab PCR capacity, as well as free treatment for all, both foreign and Thai citizens. Those who are affected by COVID are treated on a USC manner. So it's multifactorial contribution to the outcomes.
Thank you very much for your response. There is a question that's come in also for Jason. Did you feel the trust public have in you as a journalist was undermined in any way as a result of conflicting information in circulation? Jason.
Thanks for the question. There is no barometer for public trust in journalists, at least in my experience. So there's no real way to know. I know that in the early days of the pandemic, when we were beginning to see how the picture was evolving, I was getting trolled quite a lot on social media, people saying that I was overstating the gravity of the pandemic. That has since stopped. So I feel vindicated that perhaps I wasn't overstating the gravity.
Thanks, Jason, for your response. Dr. Chevik, a couple of questions for you that have come in. The first is from Natapanu, who says, I think Ms. Chevik didn't mention that crisis communicators must have an inclusive outlook. In Thailand, we had Thai and English daily briefings from the Thailand COVID Center to reach people of more nationalities in Thailand so that they can be on the same page, health and measures wise, as well as in their morale. This is where science and social issues meet during pandemics. Do you have any comments on this?
Yeah, I mean, thank you so much for the question. I think this is quite important. I think there was one slide that I passed through because I thought maybe we're a bit ahead of time, but absolutely. I mean, I think understanding the perspective of the public and understanding their issues and addressing the issues comes with engagement. So I believe that science communication comes with community engagement. So this is something that we've been doing. I mean, I'm a TB researcher. I work on tuberculosis normally. And, you know, we have community engagement groups and we come together, come up with a strategic plan, how to communicate effectively with the general public. So I think this would be crucial going forward for all the, scientists, journalists, because many people already feel that some of the expert, class didn't really understand their lives. There was one paper in the New England Journal of Medicine that basically says, I think the medical community needs to put aside their politics because, they just don't understand what's going on. I work in 2 jobs, was out of work for months because of lockdown. And, and then you see people talking on TV about to keep the economy closed. So I guess to understand different perspectives, socioeconomic perspective, different languages, we need to have community engagement, ingrained into our science communication efforts.
Thank you. And I think this in part actually answers the second question that came in for you, which was, do you think the use of participatory approaches and quality improvement methods for communicating science information will be helpful? Do you have anything further to add on that specifically?
Yeah, I mean, I'm not a specialist in science communication, but maybe Sarah, you could answer that much more, much better than me. But yes, I think participatory approach is critical, because I think at the moment we're providing too much information, and maybe that's not what the target group, what the public wants to hear. So we don't know what's the question, but we're just throwing all the information to public sphere. So I guess that's the reason I mentioned the dialogue. That will be crucial. I think dialogue between journalists, scientists, and also dialogue between public scientists. And I guess that will be, part of participatory approach. Absolutely.
Great. And I think actually Dr. Ryan mentioned that in his answers as well, that the importance of listening to the information needs of the different communities and responding appropriately that way. I think we're almost at time. However, there was a question that came in for Dr. Ryan, and Sylvie, as I think Dr. Ryan has left, I wonder if you wanted to comment on this question. The question says, in the context of a significant number of protests around the world over the last 6 months, can you share any thoughts on how science communicators can ensure that COVID-19 messaging does not get lost?
Thank you, Sarah. I think it's indeed, part of the movement, social movement. I've been seen in many countries in the world, and part of it has been different reasons for this. One of the reasons Mike alluded to is the fear. I think people are really fearful, and they really want to have answer to their concern and their fear. And because sometimes they cannot find these answers, they look for different sources of information, and sometimes they are caught into misinformation as well. And so this has been really difficult for people to differentiate, what is good from bad information. And as Mike said already, it has driven many communities to polarization. So there are people for mask and people anti-mask, and people for vaccine, people anti-vaccine, and it has, this two-way dialogue somehow has been disturbed by this polarization, because as Muge said also, what is key in this is really listening to the others, have a respectful disagreement, and try to find a middle way and maintain the communication. But sometimes when you have this polarization, there is no communication anymore. It's just different views that are just conflicting and exposed. But it's not really moving together to find a solution. It's really just expressing opinions. And the more divergent are the opinions, the less easy it's to have a true communication. So I think this is a lesson learned as well, and this is our responsibilities from everybody that by increasing the infodemic, sometimes we are also responsible in increasing the confusion. And so I think that's why I think all the speakers alluded to it. The collaboration on this issue is so critical. It's not only the problem of scientists, it's not only the problem of journalists, it's not only the problem of government. It's a problem for all of us, and all of us have a responsibility in this, and we can all play a role. And to avoid to come to those extremes where you have just group fighting over opinions, but rather trying to understand, okay, what is at stake and how can we collaboratively find a solution. And communication in this is so important. So, and I think that's why I think the question is very important, but also we all have to learn from it and see how we can do better, I would say, so that it doesn't happen like that next time.
Thank you very much, Sylvie. So before we move over to the wrap-up and closing, I wanted to ask if any of our panelists here today wanted to ask a question to somebody else on the panel. If you do, just raise your hand and we can pose that question. Yes, Dr. Viraj.
My comment are not a question to Sylvie on the WHO Mythbuster as well as 6 WHO regional office. The regional office in a strong position to solicit fact check from country specific. In EMRO, there's a set of different myths. In Western Pacific, another set. Therefore, the harmonization and synchronization to make a global Mythbuster would be very helpful, so that this is a platform of evidence, so that it's a fact check that many countries can use, make best use of it in using this to consult people whether do you believe this is true or this is false. And consideration or rectifying measure can be introduced by the government to effectively control the COVID.
Yep. Yeah, Viraj, I think the point you raise is extremely important. So, because we see, in fact, regional differences in the information and the rumors that are circulating, and even in EMRO, for instance, there was a rumor that if you notify COVID death, then WHO will give you $400. And so, frankly, we cannot do this kind of thing, and it has never been our policy. So, just to clarify this, but this is a kind of thing that we don't know where it starts, but it happens. So now what we have done is we have created a platform. We have identified more than 200 fact checkers around the world, and we will try to socialize this so that countries from different regions in the world can identify those fact checkers, and maybe we can leverage on those resources and see how we can optimize actually this effort, because fact-checking during such a pandemic is really, really time-consuming. I think Jason mentioned that how fast things are going and how overworked everybody is. So if we can put together our effort and use those resources collectively, I think it would be very good. So we have now contracted a consulting company who has done this review. We have identified those fact checkers around the world, and we will put this public very soon so that everybody can have access to it.
Thanks, Sylvie. I think we're almost at time. So I just want to say a big thank you to all our speakers and panelists today. Thank you to the participants who joined us and submitted questions. I'm sorry if we didn't answer them all. I'm sure there will be opportunities in the future. And I'd like to just hand back to Sylvie now for a short wrap-up. Thank you.
Okay, thanks a lot. So, Sarah, indeed, it was a very rich session. I was myself fascinated by all the speakers and all what you have said. I have So I highlighted 5 points that I think can be the takeover for this session. The first point is that community stops epidemics. So we need to engage, inform them, empower them, and take into account the fear factor. Second point is that infodemic management requires an infodemic management system, and this is what Viraj highlighted. The system needs a workforce, we need a plan, and we need a legal framework as well, and we need also some approaches and some tools like fact checker, that the media literacy index, and a number of things that will help us to bring this infodemic management system to a very powerful system. The third point is that by nature, pandemic is affecting the whole of society, so we need a multi-sectoral approach, but also we need to recognize that we are all pandemic fighters. So everybody has a responsibility, and we all need to be engaged in this fight and in the communication about it. The fourth point is that a pandemic is a very specific event. It's the magnitude of the event, the speed of the event, and so we will have, of course, with every pandemic, also a mega infodemic. And so in this infodemic management, what is important is the analysis, the overview, because everybody is confused by sometimes conflicting information. And so if we can do something for the world, is really have this overview and this kind of analysis from a distance that allow everybody to have a clear view of what is happening. And so within this, we need, of course, to highlight the need to evaluate the quality of the information. And the fifth point is that we are facing a new era. There are new platforms, as you mentioned, Jason, but this new platform brings new opportunities, but also new risk. So because of this, we need also new skills to manage the infodemic, new disciplines probably, and have an enhanced science communication efforts. But bottom line is that above those new approaches, we need also a collaboration, because we have many stakeholders in this, the science, the governance, the public, and the journalists, and we all have to collaborate to enhance infodemic management during pandemic, and for this one, of course, because it's not finished, but also for the next one. So this was my 5 points takeaway, and I hope we can discuss them during the PMAC session in January, so that we can contribute to the lessons learned from this COVID-19 pandemic. And so I would like to end by thanking everybody for their contribution, the moderators and the speakers, Mike Ryan from the World Health Organization, Viraj, and Viraj, I will not pronounce your name because it's very complex and I will make mistakes, but Viraj, very dear friend and very important person in this global health arena. Viraj from Ministry of Health Thailand, Jason Gale from Bloomberg News, Mugesh Sevik from University of St. Andrews, and my team, dear colleagues, Sarah Hess from the World Health Organization, but also behind the scene, we have Margot Mattis, who helped to organize this PMAC, Nikki Shindo, Professor Nikki Shindo, who helped with technical content, and Primael, who is here, who had done all the organization of the logistics for the WHO staff. So thanks a lot, everybody. I believe there is a session evaluation, and we would appreciate if you could follow the instruction that would be on the screen soon. So I look at the PMAC for the evaluation. Thanks a lot. So if you can rate this session and share with us your evaluation so that we can all improve and learn also from this. And finally, I would like to draw attention to the next session of PMAC. So, and they will show on the screen as well. The next session is assessing the situation of COVID-19 and international trade and health on 4th November 2020 at 7 p.m. Bangkok time. Thanks a lot to everyone, and let's continue this PMAC journey together. Bye-bye.